All right, welcome back. I'm Brad Lundahl. We're talking a little bit about this idea of motivational interviewing in physical rehab. We're here with Brian Connors. Tell us a little bit about who you are and what you do.
Sure. Brian Connors. I'm an occupational therapist. I've worked in outpatient orthopedics, subacute nursing facilities, home health, a lot of different areas within occupational therapy.
Right. And you're involved in motivational interviewing. How
I am.
so?
I am. Brad was one of my mentors for my dissertation in physical rehabilitation. I used motivational interviewing to help enroll patients presenting to an orthopedic clinic that were pre-diabetic. So you can imagine they're presenting for their hand condition, their wrist, something hurts. I informed them that they are at risk of diabetes and tried to motivate them to enroll in a diabetes prevention program.
Excellent. Thank you. And we're business partners in this endeavor as well, so we're combined there. So what we're going to do is talk a little bit about the applicability of motivational interviewing and physical rehabilitation. I'd like to hear what are some of the common, if you will, behaviors that you want your patients to change. Mm-hmm. For example, what do you want your patients to do more of?
Mm-hmm. Adherence. And sometimes that's a loaded term, but just staying with whatever the medical recommendations are, whether that's taking your medication at all or taking it on time, whether that's following some type of exercise advice. That's one of the problems that we run into is just adhering.
Excellent. So those are examples of doing more of something, adhering to these protocols. What about doing less of something? Does that ever come up in your world?
It does. Sometimes it's the same thing. Maybe it's physical activity and there needs to be less of the physical activity because that's leading to whatever condition is presenting, right? So we do have issues with that. Less behaviors like that.
Okay. And then just kind of for the record, resistance. That's pretty common when we talk about, engaging clients or patients to do more of something or less of something. If you recognize resistance in your patients, what might that look like? What form does it take?
Resistance, they'll find maybe, going back to maybe the exercise thing, reasons why they can't. Things like time, it could be money, a lot of times transportation, if there's vision issues or monetary issues. So they're resistant that way.
Excellent, thank you. That's a great overview. So what we're going to do in this series of videos is look at how motivational interviewing might help in some of those endeavors. So we'll get started and talk a little bit about this idea of one of the key ideas of motivational interviewing, which is this idea of the arc of focus. So motivational interviewing kind of talks about there's a story, and every story has a beginning, a middle, and an end. So when you meet with your patients, there's this idea that you might do some small talk, and then at some point you're going to wrap it up, right? In the middle, what MI advances is that, and it's not that revolutionary on some level, but this idea of we're getting to agreed upon goals, and they have some very kind of key ideas on how to promote that focus and getting to agreed upon goals. We'll talk about some of those examples. And then motivational interviewing really focuses on the client's motivation or their why. So once we've understood their what, then we're going to try to help engage the client, the patient, so that they really buy into the program, that it's their reason for moving forward, not yours. And so that's one of the key ideas of motivational interviewing. And then also talk about planning. So if you understand what you want to do, why you want to do it, now let's talk a little bit about how you might accomplish those goals. Does that seem to fit in your world when you work with patients?
It does. I think it'll fit really well.
Yeah. All right. So let's do an example. We'll do a good example and then kind of move forward from there. How's that sound?
Good.
All right.